First of all, I would like to ask to the panelists to introduce themselves, name and current responsibility and organization they belong. From my side, okay?
Okay. So I'm Gisli Olofsson, and I am the Emergency Response Director of NetHope, which is a consortium of 35 of the leading nonprofit organizations around the world, many of who've been here before today and some of who are in the audience.
Good afternoon, everyone. I'm Christian Gomez. You can call me Brad Pitt. I'm a physician by training, but I'm working now on disaster management. Our project is called SPEED. It's Surveillance in Post-Extreme Emergencies and Disasters, a paper-based, texting-based, and internet-based reporting system of health conditions that are found after a disaster. I'm the training coordinator.
Good afternoon, everyone. I'm Kraikong Wetiakan, Deputy Director from Chain Fusion. We are a non-profit organization who working with the social innovation in Thailand, and also we focus on the innovation about the technology, and we also working on the disaster response and relief. And we also have the project about the Coordination Center for Disaster Preparedness.
Good afternoon. My name is Michelle Chang, and I manage our technology working group at the Asia Foundation and work in our governance and law unit. For those who don't know the Asia Foundation, we are an international development organization based in San Francisco, as well as offices in Washington, D.C., and 17 countries across the Asia Pacific. And we've been working across Asia for nearly 60 years now, working across governance, so legal aid sector, as well as elections work, as well as environment, women's issues, economic development. So we work all the way from Afghanistan down to East Timor, working with local partners in Asia and partnering with national leaders, as well as civil society organizations and international donors.
Good afternoon. My name is Kenji Hiramoto. I'm Executive Advisor for Chief Information Officer in METI. METI is Ministry of Economy, Trade, Economy and Industry. And I oversee all information system in our ministry, and I'm working with government-wide e-government team and open government team. We will publish open data strategy soon. So.
Thank you. To kick off this discussion, I would like to ask Kian-Long to share his experience and his organization doing in Thailand. Particularly Thailand, as you may know well, the last year had a disastrous flood. So Kian, please come to this podium, and the operator can share with you your slide.
Okay. Actually, I have been asking for reduce my slide.
Oh, okay.
So I am speaking without a slide. But before I go to the tell you about the flood situation last year, I would like to give you the overview about the open data in Thailand. So the open data, especially the government data in Thailand, is right now is we have the Open Government Information Act since 1997, and all the government data, the information is uploaded on the website, but mostly it's the format of the Word document format and also the PDF file, not master law data. So that is quite difficult to generate machine readable data. So that after the flood situation in Thailand last year has they have changed a lot of the government data. A lot of data have been released. For example, in the satellite images, and also the mapping, and also the data from the sensor, for example, the water sensor in the canal and river. So that what we have been doing, if you see the slide, this is a system we have developed it last year for the SMS alert. When the people search the location, they would like to alert when the water in the canal near their home rising up to the critical level. This system will send the SMS to the subscriber. On that time, we have the 6,000 subscribers to receive this information. But this information is, we use the way we call hack for kindness. Yeah, it's because the government website who provide the data about the water level in the canal is not provide the API, so we have to do some kind of to get the data from their database to use for this system. The next slide is this we call it Info-Aid. Info-Aid is have the purpose for relief efforts after the flood. This is convert data from the unstructured data from the government report about the damage of the schools, of the community, of the project that the relief project in the area. And also you can see the data from the community that what the supply they need, and we collaborate this data to the volunteer group to find the supply they need and send the supply to the area that got damaged from the flood. Yeah. What we would like to see about the open data of the Thai government, first of all, we would like to see the standard name of the data. Actually, right now is that the government, Thai government, working on the standard of the data. They're working on the location format, the thesaurus of the data, and also the wording, the vocabulary that can describe the situation, the level of situation, and also all those data should be open in the machine readable format, as well as the copyright of the data. It should be the open platform copyright, for example, Creative Commons license. And also the government website who provide the data should provide the API as well. That's all for this round.
Thank you. I'm wondering, I should ask each of you to some question particularly related to his presentation, or maybe later on we'll summarize everything and then discuss the final time we have in this only 45-minute session. Which do you prefer? Later on discussion? Yeah, okay, thank you.
Thank you.
So then I will ask Dr. Gomez to share your experience and doing particularly SPEED.
Yes. Good afternoon once again. So SPEED is Surveillance in Post-Extreme Emergencies and Disaster. It was made to be of that name to make it a bit more catchy. It's a collaboration of the Philippine Department of Health and my organization, the World Health Organization, with the support of our following development partners. It was based primarily on the experiences in Typhoon Tropical Storm Ketsana, Mirinay, and Parma in 2009. So basically, it has three objectives. One is to detect early the unusual increase or numbers of communicable and non-communicable health conditions, to monitor health trends, and to be able to identify where the appropriate response needs to be delivered to. SPEED is syndromic in nature. It means that any volunteer, even a non-health professional, can begin to report the health conditions that they will see because it is based on signs and symptoms. Second, it is built on the current information communication technology in the area. It can be paper-based. It is primarily paper-based. It can be texting-based. It can be via voice call. It can also be via internet, depending on the available technology. And that's used for data collection, analysis, and report generation. We focus on the 21 health conditions that are frequently observed and noted after any disaster has happened in the Philippines. And we have an alert notification system wherein if a certain health condition has breached the supposed number or the acceptable number of health conditions or number of cases, the system will be alerted, and as well as the key responsible persons. And most importantly, it complements the routine health surveillance systems in the Philippines. So it's just an early warning for us to know what's a possible outbreak may be erupting in this particular area. So just a little information. It has been 28 months since the project has been conceptualized. We have covered all of the 17 regions of the country, covering at least 90% of all our 1,717 local government units. At least 3,300 health staff have been trained. It has been used in 6 major events, 4 tropical cyclones, 1 volcanic eruption, and 1 massive flooding. We've had multi-province simulation exercises, so even in the quieter times of the year, despite the Philippines being the supermarket of disasters, we are able to keep our health professionals on their toes. And lastly, this July 17, 18, and 19, we will be having a nationwide simulation wherein all of the health facilities, that at least 1 health facility per city, municipality, and province, even hospitals of the entire country, will be trying to send text messages simultaneously for us to be able to see how the system will be able to absorb all of the information. Basically, it works from the left to the right in clockwise order. A SPEED reporter is assigned in a health facility, an evacuation center, or a rural health unit. He accomplishes a form, transmits the information via SMS, the information received in the server, and then that is converted into a website. From the website, the municipal doctor will be able to validate the information if this is true or just a rumor or just a problematic recording of health conditions. And then a report can be generated immediately from the website, graphs, charts, and we use Google Maps to be able to visualize where the clustering of health conditions are being noted. And if the mobile service is not available, we use other modalities such as hand deliver it, or if other modalities like radio communications is available, we will be using that one. This is an example of a screenshot of our website. The messages come in a central table of contents-like form, and then from there you can generate information, tables, graphs, charts. This being early warning, we pass it on to the routine health surveillance system of the government, and then they are the ones who churn out the report that have been validated, so that this is what we were mentioning earlier about authoritative data and not just mere rumors or unclean data, so to speak. Thank you.
Thank you. Then I would like to ask Hiramoto to share the practice of the Japanese government.
そしたら日本語で
Well then, let me speak in Japanese. So I would like you to use the interpretation services. Even at the Japanese government, there are some data which we could publish and could not publish. And the big data, for example, the radioactive data, was not disclosed in the past. We did not really expect, or we didn't prepare that these data would be published, so that we could not really disclose them, and then we had been criticized. But having said that, I would like to give you some of the updates in our activities. First one, well, at the time of the disaster, that communication infrastructure itself was very weak, and the social media, such as Twitter, was very active. But some of the people became actually being someone else, and then phishing, and then some of the misinformations were actually distributed. However, Japanese government's information should be authoritative. Therefore, that the central government and then local autonomies and these addresses should be certified addresses. And we, first of all, made a list of certified addresses so that you can actually trust information coming from these addresses. And please go to the next one. And then, as Mr. Ishii's session talked about why the government does not release information, or sometimes informations are coming out in the PDF format so that you cannot really use them. And even at academia and also institutions, you can't use them. So the central government, local autonomies, and also private companies, we recommend to publish the data in usable formats. That is because that some people don't want to disclose the information, but some people just publish them in PDF without giving any special thought to. So we made a recommendation for them to make it in a usable format. Another one, which is a concrete project, this is the TEPCO examples. We have made a request to TEPCO and other electric powers and asked them to provide the supply information. First, they came up with the PDF and images, but we asked them to use an API. So right-hand side, as you can see, the green graph. These are today's supply forecast and also actual usage. And again, we asked them to come up with application for the wireless devices, and also digital signages are available for these different supply and demand forecast. For the middle term and then long term, we are planning to publish more government information, the supporting services, such as supporting for the construction of homes and others. And this information can be published. So the central government and local autonomies have one common format to provide the information about these different supports. We are using API, and at the same time, the private companies can combine their information with this. Next, this is a trial project. Information which were on the social medias collected, and we analyzed them. And every day we try to look at what are missing in the disaster-affected field. These circled areas, gasolines, fuels, fuel-related materials were lacking. And we organized some of the things which are lacking in the field. We can analyze them and try to release the information of what are necessary there. However, well, it's a semantic technology, but we could not really come up with the streamlined method. But next time, by preparing the data catalog so that we can analyze these social media information and then try to depict what are missing in the affected area. So that's it from us.
For me to ask Gus to share the open data. Unfortunately, we don't have his PowerPoint, but he will provide a nice comment on what open data is. Please, Gus, on the podium.
I don't like PowerPoint. I'll quote the author Paulo Coelho, who says PowerPoint is for people who neither have power nor can get to the point. That's why he's a best-selling author. He can get that in 140 characters. But we've seen in the last few years a big drive towards open data, especially within governments. But I think it's important for us to understand that there are a number of issues that we need to address with regards to the open data that we're not necessarily have been talking all about here today. One issue that we certainly face is that the amount of open data or the focus on open data so far within governments has not been on disaster-related information. Now, it's true that a lot of information like where do we have schools, where do we have hospitals, and so on, is very important baseline information for us in the response. But there's a lot of information about how we respond and what the situation is like where we don't have standards. And that means that every one of us, different organizations, different countries are coming up with different ways of representing the same data, and that makes it less reusable than we should have. The other thing that we need to remember is that a lot of the effort so far has been in the developed world. And there's a lot of disaster-prone developing countries that do not have the capacity to do the same kind of openness as we can do here in Japan or in the US or in UK. So we need to figure out how we help them, and that takes donors, that takes funding, but it also takes a lot of capacity building, because we need to train up people in these countries to actually do information management. And at NetHope, we've been looking at this issue now for about a year and a half, figuring out how can we improve information sharing amongst everybody through openness. So we're not just looking at the government data, but also how do we actually start opening up the data that the Red Cross, that World Vision, that Save the Children, that the UN is collecting, and what happens when we start sharing that data between each other? Can we actually get a better way, a better understanding of what the situation is like? Can we then make better decisions? And what does it take to get there? And there's, it requires a collaborative effort. It needs the technology sector helping us figure out how do we actually share the data in an effective way. It takes the humanitarian organizations to actually want to share data, to get over the fear that if I share data, someone else is going to take that data and get funding from a donor because they had the data quicker. Those are the excuses we hear. But we also need the academic and research community to work with us to figure out how do we come up with new, innovative ways of addressing the complex, chaotic environments that we deal with in our world through more open data, through more information sharing. And we need to do this in a way that is distributed. It needs to be so that it works for every one of us. We did this mistake of teaching decision makers a few years back that we should have portals for everything. So now everybody says we need a portal for that. You need one portal for all the recovery in Japan. No. You need to have access to that information wherever people are used to going and be able to share that information in different sources in different places. So we're doing hopefully launching this fall an initiative with a number of organizations from all of these sectors that I've mentioned earlier. It's an initiative we're calling the Open Humanitarian Initiative, and if you're interested in knowing more about that, then catch me at the cocktails, and I'm happy to talk about that.
Thank you. Then I think also that it's good time for Michelle to introduce your Asian Foundation to help developing country, and particularly you are in the legal side, I understand. So maybe the copyright, open data is open, okay, or anything you have. Yes, please.
All right, I don't have a PowerPoint and I don't have a quote to recite. So I think, as we've heard today, open data initiatives can be very powerful, from the World Bank Open Data Initiative to Crisis Commons and Global Pulse, among others. And as we know, the open data can save lives in times of natural disasters. It can empower a population, and it can make government more open. Much of the conversation as of late has been centered around technology. And I think, as we've heard today, there's been references made about some of the political challenges, the governance challenges facing really effective open data implementation. So I'd like to speak on 3 of these main political challenges, namely proprietary and legal issues. So some questions we may ask ourselves are, who owns the data? What can we do with the data? And what kind of licensing frameworks surround this? Second, there are the government culture considerations. Governments are fairly inclined to control information, so they don't have that experience to share information, whether it be on budgets or on census information. Third, there's coordination issues to consider as well. Data, as we know, has a creator, a owner, user, and affected populace. But not all the time do these groups speak to one another, and this lack of coordination could really hamper effective implementation of open data. So I'd like to briefly go over with you some examples, not necessarily disaster related, but taking, for example, transit data. So looking at proprietary issues around, for example, the Austrian transit system, which some of you may be aware of. It's run by a private company, and the private company provided feeds to Google Maps to provide this information to the public. Then a startup came along and created a mobile app to provide transit data of their own, and the private company pulled their data from Google Maps and no longer made that available. So this type of scenario begs the question of, if data was once open, can it be taken away from the public? Obviously, it's not an easy question to answer, but it's something to consider in how to make open data truly effective, and it's not so much a black and white decision. Second, let's talk about government culture. So as I mentioned, government cultures are not always inclined to share information. We've seen some progress in this area with the Asia Foundation as we're working throughout Asia, where there's legislation being passed around freedom of information frameworks. We saw in 2005, India passed a Right to Information Act, as well as Bangladesh in 2009 and Indonesia in 2010. So progress has been very good. It's been slow for obvious reasons such as corruption, high costs, a culture of secrecy, but the national level commitment really needs to be there in order for the local agencies to get involved in the open data discourse. So now turning to the third challenge of coordination. I think Clay Kong alluded to it earlier regarding the Thai floods from last year, which were clearly devastating. It requires coordination at many levels, from government to nonprofits to relief agencies, the public, private sector, et cetera. And the Thai government quickly responded by setting up a flood support operations center, working with ministries, as well as private sector and civil society. And they were providing a hotline and website to provide flood information to the public. And it turns out the private sector actors involved in this, as well as civil society, found that the government was controlling a lot of information and not releasing it in a timely, consistent, frequent enough manner. So this kind of shows the lack of coordination, or an example where coordination could be improved to really make open data more effective. So clearly, I think technology is part of the equation. That's not, that without a doubt, it's a key enabler. But I think the political landscape also needs to be taken into consideration. So the Asia Foundation has been working in this area for a number of years. Related to the first area of proprietary issues, in the Philippines, we're working with local government to engage the public more in budgeting processes. So in Mindanao, for example, we started a budget tracking program so that citizens could take part in the budget drafting process, authorization, and execution of budgets. So now government and the public are smarter about each other's needs, and transparency is much higher. Second, related to government culture, in India, now we're working with our partner Transparent Chennai and Intuit, based in California, and we're empowering citizens with mobile phone applications so that they can keep government at the ward level accountable on services from garbage collection to water delivery, so that citizens can really take part in helping to improve government quality of service. Now lastly, turning to the issue of coordination. The Asia Foundation has been working in the Pacific Islands for over 15 years now, working across multiple levels from national, regional, local governments to help them train around coordination and planning. Clearly, the Pacific Islands are small and they're spread apart, so communications are vital for survival. So we've been training and building the capacity of these government officials and helping them set up systems such as weather, early alert systems, as well as wind vanes, adopting SMS technology with that as well. And in Vietnam, another example is we are building public-private partnerships with the small and medium enterprises and connecting them with the Vietnam Chamber of Commerce to work together towards disaster risk reduction efforts. So just to sum up, these three issues around proprietary government culture and coordination issues are key, and technology plays a huge role in this. Open data initiatives are on the rise and they're very exciting. But I think the technology needs to go hand in hand in concert with the political landscape and the political economy of information sharing. And through that, the power and authority between state and public, as well as private sector, can be shifted and provide open data more effective ways of implementation. Thank you.
Thank you, Michelle. So Michelle has already started the discussion, I guess, and however, to touch on open data later, prior to that, I would like to ask each panelist to comment on what the current situation we have in government data collection, distribution, sharing, whatever aspect of we have in current government. Again, open data might be the solution in the future, but not to touch at this moment. We'll discuss that later. But before that, Michelle described various countries and Grant shared with us the Thailand situation, and Mr. Hiramoto shared the difficulty to share each ministry's data in Japanese government. Anyone have some comment on the current observation you have in our government as is?
I think that, the various countries you go to and you look at the open data, you'll see that the levels of information sharing are very broad. I mean, you have governments who are trying to share almost everything and are doing a great job. They provide an API to it. And then you have the other end of the spectrum, which are...
Just trying.
They're trying, and sometimes it's, to them, sharing it as a PDF file is considering to be open. And, sharing things as a map, they think that is being open data. What we really need is the API access. It is this reusable data that we can really take, because what really becomes interesting is when we take not just one set of data, but actually a couple of sets of data from different sources, and we start layering them on top of each other, and we start to see really innovative new things out of that. And you can't do that if all you get is a map. And in disaster response, we're fantastic at submitting our situation reports to the donors, preferably daily or once a week or something. And guess what? A Word document, or whether it's written in Microsoft Word or Google Docs, as text is not something you can easily reuse to do things. Same with the maps. We all see these wonderfully produced PDF maps that are shared by the response organizations or governments. Those we can't reuse. If I take an example from earlier, entity Docomo showing in the video how they were starting to share where mobile connectivity was coming up. Well, for me, it may have been interesting to see their map on top of SoftBank, on top of the other the mobile providers, and say, okay, here's an area where there is no connectivity. But because each one of them was publishing either a station list or a map, I couldn't aggregate those together to give my organizations, when the tsunami hit, a good overview of, you're not going to get any connectivity here, but you can use this phones here, these phones there, and so on. That kind of illustrates the importance of having that easy access to the data.
So, Dr. Gomez, the speed touch on some information, very critical for the current situation, but also I think it's touch on the level of hygiene of a particular country, right? And maybe some government has a hesitation to show or share that with outside, particularly his own country. How did you describe that?
Yeah. For many of you, you may be the technology experts and then you reverted to health or disaster-related work. I'm at the other end. I don't know what API is, so I'm sorry about that one. But what I know is that people need help. Disasters have phases, and the disaster doesn't end when everything's all restored up, all of the roads are cleared. The health conditions would crop up 2-3 weeks, even months after the disaster has struck. So that's why it's integral that we do not let our guards down. Having said that, our country is what you were describing. We're still in the younger stage, I guess, of the information sharing. You can access census data, you can access reports of the Disaster Risk Reduction Management Council online. You can be provided with all of the PDF files, but I was thinking in my seat earlier how beautiful it would be if, because for the speed, we mapped all of at least 12,000 health facilities, evacuation centers, hospitals, rural health units in the Philippines. How interesting it would be if we could overlay that with the hazard maps that Margareta showed earlier and see which among of the health facilities that we have mapped via speed will be useful or useless should the disaster strike. So in that regard, we're still a very infant country, I guess, but we have a very robust open source and open data community, but I fear they are still limited to the academe, to the ones who are in the know. But in the bigger general work, I think we still have a lot to do. And maybe speed can contribute to that because, as Michelle was saying about coordination earlier, we now have a standard reporting form. So MSF, Red Cross would have different forms, but we hope with our system, we will be able to share information better and then overlay it with other expert products that are free of licenses, etc.
Many people think today the PDF is the most popular format, and not just popular, but also open the format as well. However, if we have very idealistic open data era in the future, hopefully, how do you think that format itself play the key role, or more linkage, like a link to open data or URI instead of URL? Sorry for that many jargon, or even API is not popular for everybody. But someone should comment on that relation of the content of information and how we access that relationship of both.
Yeah. First, I think is the PDF format is show the attitude of closed data because the PDF cannot edit anything.
Right.
So they should provide some kind of data can do more edits and usable. And also, the important thing is about give the credit, yes, for the data owner. And other thing is about the utilize of the data. I think in the community level, local community level, it should be empowered in the data and information literacy, because the big disaster not frequent happen, but the small disaster in the local community is the frequency. So they should know is the local data. For example, the number, the rain of the raining in the area that is have the raining too much can have the mudslide in the area, so they have to collect the rain data in the community. Also, when the telecommunication is fell down during disaster, they should have the sum of the plan B of the communication. Actually, after the flood, we have the option to communicate, like that we back to the amateur radio walkie-talkie to communicate, and that we think about, look forward how to work with the voice data to collect with among the amateur radio network.
I think at the Asia Foundation, we see, in the past decade, we've really moved away from an information age into this era of data, right? And we've been collecting data through public perception surveys, like our Afghan survey, which is annual, as well as focus group discussions, all sorts of data. But I think the question, and it was brought up earlier, is how can that data be made actionable and understood and used by the people that are most effective? So I think, going off of what Clay Kong and Brad Pitt, Dr. Gomez said, I think, the standards are vital. Otherwise, all this collection of data is pretty meaningless.
So in a flood case in Thailand, you said you use many centers distributed to the countries to such the level of flood, how they are rising. My understanding is correct. The water level,
Yeah.
sensing,
Yeah.
kind of based on sensor
Yeah.
you located.
Based on the government sensor.
And the other case, particularly speed, you have some informer or I forgot the wording. How we should verify or confirm that data we are collecting from sensor, but also people. How we evaluate those correctness, or maybe some bad data, or anyone has?
Yes. About the verify of the data, actually the water sensor is from the government website, so it's if we trust the government, we can trust this sensor. Anyways, the crowdsourcing report in that location is important. It's maybe also that's it machine data, so that people who live near the location should give some information to compare with the machine data, and also use the social media for like that verify the data, compare with the government data and crowdsourcing data.
Okay, so
maybe just to follow up on that, I think one of the things, like you said, has happened is that we now can verify data through multiple channels, and as we're getting data in, whether it's through the sensors or whether it's through humans, we're going to have to collect all that data and have it in standard ways so that we can use it to visualize things. But we also got to remember, why are we collecting data? Why all this data? And sometimes when I talk to my friends in the digital volunteer community who are monitoring things like Twitter and other things, they think that I want to know all the data that they can collect everywhere online, because that's going to make me be able to make better decisions. The truth is that, giving me a fire hose of information is not going to make me make better decisions. So what we need to start with is to actually start at the end and ask ourselves, what kind of decisions am I trying to make? Then I ask myself, how can I create visualizations like maps, like charts, and so on, with help from Jake or some good organization? How can I create that visualization that helps me make that decision better? And then I work my way back to how do I actually collect it? Do I get it from sensors? Do I get it from people? But what we got to think about, though, is that my decision is going to be different from your decision. What you're trying to answer is different from what I'm trying to answer. So what that means is that we cannot end up creating PDFs and maps and think that they're going to serve everybody. It has to be interactive and customizable situational awareness tools for each one of us, and it's going to be different data. If you're worried about health, okay? I may be worried about where are there people trapped in buildings. You may be worried about flood levels. We're all going to look at the same kind of data, but we're going to need to visualize it differently to make different decisions. So we got to get out of the thinking that there's one way to solve everything, or one ring to rule them all, to do another quote from Tolkien. It needs to be this interactive way for us to do that.
Thank you. Mr. Hiramoto shared with us some good wording. I remember it's we need semantic technology instead of just the data itself. Would you please describe a little bit more what do you mean?
すいません。
Please allow me to speak in Japanese. For example, so the definition of a family, and each other organization has different definition of family. For example, Ministry of Welfare's family definition is this, and the other ministry's definition is like this. So if there is a different definition of families, even if you collect data, you cannot utilize those data as is. Therefore, from that point of view, we have to have a standard format. That is one of the things. As a next step of the format, we have to have aligned data, or when you collect the data, and some of them may be depicted in a graph, or some of them may be in a different format. So we have to collect them in a standard format. Thank you very much.
Some comment on as a kind of a technological aspect of open data, what we can expect if it's go well in the future to solve such a problem of the definition of each wording is different.
I actually think that the problems we face in open data are not technologically related. Mm-hmm. Most of them are politically related. Sometimes I say they're fear of decision making related. Like, why don't we have a standard for these different things? The UN set up a cluster model 7 years ago where it defined a health cluster, education cluster, and so on. Why doesn't the health cluster have a standard way of collecting data? What have they been doing for 7 years? And I know I'm being very politically incorrect to say that, but that is the problem. We need to make those kind of decisions and move these things forward, and it has nothing to do with figuring out what technology we're going to use. Because if we don't agree on what a family is, for example, like you just mentioned, we're not going to be able to agree upon how we're going to respond and how we're going to coordinate. And we've seen report after report come out after disasters, pointing out the same issues that we're running into, yet we don't address them. So let's, even going to a new disaster, I get a different contact list format that I need to fill out every time with the UN. And I can't understand why a simple thing like a contact list cannot be standardized, let alone, you know, health facility and all the diseases and so on. That we need to agree upon, that we need to do, and that's a political issue, and that takes leadership. And that means that organizations, some of who are in this building and have been here today, need to make a decision and start moving those things forward. And we need to agree. We need to stop, you know, arguing what a family is and just say, okay, a family is defined this way. Well, let's stick with that. Okay, it's good enough. Let's stick with that and let's move on.
Yes.
It doesn't take 5 years of 27 international conferences to define what a family is. Okay?
Thank you, Gus.
Sorry for my Icelandic politically incorrectness. But
So, Gus, please. Yes.
Yeah, so Kenji underscored even intra-government problems. Problems of what is a household, what is a family, what is a health facility in our language. So that's one thing that we have to really iron out. And then second is, I guess it's a problem. I initially thought it was a problem of lower middle income countries, but it's also all of a common problem. It's projectitis. So when a partner, a donor, a moneyed agency would come in, they would introduce a certain topic, a certain modality, a certain technology, and then it's a 2-3 year thing. They leave. We don't have any more funds. We are not able to sustain it. And then another funding agency comes in. They set another standard, and then those two don't match. There's no interoperability, and so the problem of having to share information now is exponentially bigger because even the sourcing out of data is difficult in the first place. So that projectitis is very evident also.
Thank you. The discussion should be continued on. However, already the moderator is sending lots of body sign to. I ignored, but it's 6 minutes overdue already. So I would like to have that. No question from floor.
they'll have to ask us questions over cocktail.
Okay, so, I'm sorry that we have enough time to get some question and answer these very important areas, particularly folks in Japan. We are arguing and also suffering from part of some openness or unopenness of the government data now. However, sorry, again, the time is over. So give us particularly 5 panelists for big. Thank you very much.